GP waiting times in the UK are worse than Rwanda, China, and Russia, a study has found. We're going to read into this more from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is REGANELITE here with an article from iNews with the headline that GP waiting times is worse than Rwanda, China, and Russia, studies finds. And about 35% of patients saw a doctor within 24 hours in the UK, making it a third worse for GP waiting times, the global index has said. In the last 13 years of Conservative government rule, GP's waiting times have skyrocketed without a shadow of a doubt. The austerity measures that were imposed since the conservative and coalition government came into power, originally the coalition into the conservative government came into power, there was a real need for a real desire from the conservatives to cut everything down, to make a means to an end, to pay back a sort of debt of that they made at the time. That was the interpretation and the idea that they wanted. The narrative that was created. Instead of doing the opposite of continuing to flourish and grow as a nation, we were cutting back as a nation. And after 13 years, you can see, you've seen that when you try to get a doctor's appointment now, of how hard it is to get one based on the last 13 years. Now, of course, the last few years people will argue, well, COVID has had an impact, Brexit has had an impact. There's other mitigating factors such as the lack of doctors and nurses, which is in turn tied into Brexit as well, because it's harder for us to get the workers that we need now. There's been changes of laws, but that doesn't change the fact that before even COVID, before we officially left the EU, we were seeing at Christmas times the difficulties that the NHS were having just to maintain their services. They were always in the papers, they were always on the news. NHS crisis during Christmas. It was constantly happening every Christmas. And why was this happening? Because the Conservative government was cutting back on everything. And as they were cutting back more things turned into privatisation, which then in turn, as people got more and more fed up of waiting for their doctors, waiting for their treatment, because that's what we're starting to see, more people are now turning to the private sector, putting their hands in their own pocket to pay for necessary healthcare, whether it's just to live, or just to get the medication that they need. And that's exactly what they wanted. But yet, in terms of looking at these numbers here, it's pretty remarkable to say the least here. So this graph here, as you saw on the thumbnail, of course, it's from the source Economic Impact. GP waiting times in the UK are worse than of Turkey, Kenya, the US, Algeria, and Germany. This shows here. So you can see here on the GP waiting times list there, the United Kingdom, so 35.3%. France is 33.7%. So we're still not as bad as the French. We're not as bad as Canada, which is 30.6% there. The US are doing better than us, 41.7%. But if you look in comparison, Germany have an amazing record there, 73.2%. Turkey 88.1%, Kenya 84.6%, Rwanda 87.4%, and Algeria 86.6%. So it's just a couple of nations. I'm wondering if it's going to show us some other numbers there. But let me know what you guys think of some of these numbers in the comments section. So patients in the UK are waiting longer to see a doctor than people in the countries including Rwanda, China, and Russia, a global health survey has found. For appointments to see a GP within 24 hours, the UK ranked the third worst of 40 countries surveyed, according to the Economist Impact Health Inclusive Index. Just over a third, 35.3% of British respondents were able to see a doctor within a day, with only Canada 30.6% and France 33.7%, ranking lower than the UK. And the figure is falling far below the global average of 66.8%. So based on their survey, the average is supposed to be 66.8% time of seeing a regular GP. That's the global number there. Almost 1 in 5 people in the UK, 16.9%, said they had to wait longer than a week to see their GP, compared with 7% globally. Even war-torn Ukraine saw better waiting times for a GP than the United Kingdom, with 72.3% saying that they had access to primary care doctors within 24 hours, while in Russia more than half could see a doctor in a day. I think it's important to add a little bit of context to that. Like, as it just said, there's a war going on there. So obviously they're going to prioritise the healthcare Ukraine to ensure that they look after their soldiers in a bloody war. And the same will say for Russia. So I think that's a bit... I don't think that's a fair comparison, considering they're at war. I'm just going to put that caveat in there. Although I do understand the premise of why it's trying to cross that, but I think it's important to have that, remind yourselves that they're at a war with each other, and Ukraine is fighting for its existence. I think that's important to put that into perspective when looking at those numbers. Turkey scored the best for short waiting list times, 88.1%, followed by Rwanda at 87.4%, Algeria 86.6%, Kenya 84.6%, and Mexico is 83.8%. How has Mexico got such a high healthcare? Curious to know about that one. Maybe if someone can let me know in the comment section down below. I guess it's to do with dealing with responding to drugs or something, perhaps. I don't know. I'm just spitballing there. The index released on Monday, which surveyed 42,000 people worldwide, was supported by consumer health company Haleon, ranked in the UK's third overall as the most health-inclusive country. This was based on the vanity of factors, including politics, systems, spending and access. The UK scores fell by 13% this year, meaning it slipped from top place in the global rankings and is now behind Australia and Sweden, which came first and second respectively. Struggles with accessing a GP in the UK were mirrored in other British healthcare services. The study found, with fewer than a quarter of respondents saying they could access dental services or sexual health services within 24 hours, compared with an average of just over 50% globally. However, people in the UK place very high on levels of trust in the health information available on government websites, such as the NHS website. Nearly two-thirds said they could always access useful and trustworthy sources, compared with the less than half globally, than more than any other country worldwide. One thing the NHS has it's a very good source of information. And you got to give credit where credit is due. That website is actually very informative. There's a lot of information there. And it's one of the most accurate, shall we say, of information when it comes to knowledge of your healthcare and what you might have. An NHS spokesman says NHS GPs and their teams are working flat out for patients, for delivering record numbers of appointments. Patients are benefiting from 500,000 more appointments each week compared to before the pandemic, and 40% of appointments are on the same day. Spokesperson said that easier access to GPs was a priority, and the NHS have recruited 31,000 extra staff to GP teams since 2019, meeting our targets early. The Department for Health and Social Care spokesperson added, "It is vital that the public can access primary care services when needed, and we are making it easier for patients to see and contact their GPs, with 29 more appointments in every GP practice per working day compared to 2019. The spokesperson said that the government was investing $240 million to help practices embrace the latest technology and beat the AM rush that had delivered more than 20,000 additional doctors since 2019. We're also making progress to boost NHS dental services." We've got some way to boosting that. Compared to the previous year, 1.7 million more adults and 800,000 more children are receiving NHS dental care in England. The study found health inclusivity sources had deteriorated across 85% of the countries surveyed, with persistent disparity between policy and practice, particularly in high-income countries. A report on the index entitled "The Road to Health Inclusivity from Policy to Practice" said the gap underscored a harsh truth: well-intentioned policies do not automatically translate into positive health outcomes. Jonathan Burwell, the global head of policy and insight at Economist Impact, said, "Measuring a country's ability to provide quality healthcare involves evaluating its policy, but also its population's ability to use their healthcare service. The results of this phase of this index shows that high-income countries still have a lot of improvement to make if they are to effectively turn their policy into action." The study found that 66% of those surveyed faced at least one barrier in accessing healthcare services: lack of available appointments, inconvenient hours, distance and cost and travel, and a lack in trust in healthcare services were most widely reported. Sarah McDonald, the Vice President of Sustainability and Social Impact at Haleon, said, with the index revealing high rates of health exclusion worldwide, more action is needed to overcome this barrier, particularly for vulnerable populations. These latest findings reveal a clear gap between policy and experience, as the inclusive health ambitions of many of the world's wealthiest countries are out of step with the reality of their citizens. But it's also important to caveat, guys, again, and it's important another caveat to add. The caveat, of course, is that it is a survey, but it could be, we don't know how 100% factual it is. But it's an indication of what healthcare services are like in other countries in comparison to the UK. So I say think of it like that rather than this is as saying these are the exact numbers. It's not I wouldn't call it the exact numbers, but give us a rough idea of numbers of what they are like right now within the UK in comparison to some other nations. But maybe some of you guys who are watching this right now may have different views on these numbers. So what do you guys think? What do you think of some of these numbers? Do you think these numbers are pretty accurate, pretty close to what they are in comparison? Obviously, it's hard to us to read nations such as Algeria, Rwanda, and Kenya in Africa. It's very hard for us to distinct those. Does the likes of Russia and Ukraine make logical sense given that they're at war with each other? I think that is. Are you surprised that the US actually having a much faster GP time than the United Kingdom? Does that surprise you? Let me know all your thoughts in the comment section down below. Hit the like button, be greatly appreciated. Share across social media and hit that bell notification icon so you'll be notified of when I upload another video. And if you want to financially support me, you can do so by buying me a coffee or joining me on Patreon. Thank you very much for watching, and I hope to catch you all very, very soon.